The Central Valley is such a vibrant and amazing community. It's where the richness of the state comes out, from our agriculture to the local businesses. And there's so much incredible diversity in this community. There's so many assets and amazing things that this region contributes to the state and to the nation. And so I'm excited to be here today talking with people about how they experience health and healthcare and what they really think we need to do to solve some of our biggest challenges.
A lot of people have come and asked, what are the outcomes that you're seeing from a health perspective on the closure of Madera Community Hospital? Because there were so many specialties that were included in the rural health clinics, access to a labor and delivery and emergency department in particular. And we have heard lots from the community about individual stories of people's experiences with regards to not being able to get to the healthcare that they need to get to and making tough decisions about how they're going to spend their time. Do they go ahead and get to that preventative healthcare visit or get to their dialysis treatment, or do they prioritize their limited funds not on that transportation but on buying groceries? And those are difficult decisions to make.
I learned to give insulin injections when I was 12 years old to my Tia Maria, my beloved Tia Maria. She struggled with diabetes, and she ended up losing her toe, her foot, her leg, and eventually her life. Delayed care is delayed treatment, and it's premature death. And that is, unfortunately, a very common experience for disadvantaged, low-income community members, but our population in general, as Sarah has just mentioned, right? It's not just affecting us, but it affects us profoundly.
Some of the things that we've done, we have a clinical pharmacist on staff. Although this is not a billable service for us, we see a huge value in having a pharmacist to collaborate with, which really helps to encourage compliance and understanding, and hopefully is helping to contribute to better outcomes for patients. And he does things like he draws a sun on pill bottles for medications that they need to take in the morning, or moons on pill bottles that they're supposed to take in the evening.
We've benefited from a long legacy that precedes my time at COIA through a very, very healthy and robust community health, a community outreach division at COIA. So employing promotoras, community health workers, participating in the DHCS navigation program, where we're out in the communities, home visits, out in the fields, holding events, hiring people from the rural communities to be that promotora. And so now they're hearing it from a neighbor or somebody that they can know and trust, and getting them to trust to enroll, and now we can get them access.
Primarily, we're doing a lot in the nursing space, which is aimed at trying to develop the next level of certified nursing assistants. Hopefully, the pipeline from certified nursing assistant to LVN to RN will hopefully create a pipeline of nurses that would help that community background, that community.
Taking care of a patient whom I just diagnosed diabetes in, and after going through the mechanics, I was going to use insulin, and after going through the mechanics of how to attach the needle to the syringe and drop the insulin and how to select where you're going to inject, I reminded him about needing to refrigerate the insulin, and he asked, well, how can I do this if I work out in the fields all day? And it gave me pause, and I had to actually think about that, and I realized that I was going to need to become better informed and more creative about how I was going to care for my patients here because of that. But I also thought about how many patients I had already prescribed insulin to who maybe had not felt comfortable enough to ask that question, and who had gone on managing their lives and trying to figure out how to do this.
And so it's one thing when we look at these numbers, which I'm a data nerd, I love looking at them, but we also have to remember that what's the individual story for these people?
Overwhelmingly, we hear concerns around healthcare costs. More than 6 in 10 people here in the Central Valley say they have skipped or delayed care due to cost in the last year. And as I named the pieces on workforce earlier, that resonates with folks here in the Central Valley as well. Half or more of Central Valley residents think that their community does not have enough providers, particularly mental health providers.
We found nearly 2/3, or around 63% of adults living in and around Fresno reported skipping or delaying healthcare due to costs in the last year. What are we talking about? We're talking about not going to the doctor because someone is worried about the cost of that visit. We're talking about not following through on a recommendation that a doctor made around a test, a treatment, a follow-up procedure because someone is worried about the cost implications for themselves or their family. Those findings are very, very stark.
I think if something that we can really cherish in the Central Valley is the partnerships and collaboration. We have a true spirit of collaboration and a true spirit of partnerships because of the resilience that we need to have to really bring together the limited resources that we have to have the greatest impact. But at the end of the day, the true asset that we have in the Central Valley is people.